Safe patient handling and mobility increases patient safety and reduces injury for both the patient and the healthcare worker. There are a few general rules. A healthcare worker should not lift more than 35 pounds under ideal circumstances. A patient should be assessed every time before trying to mobilize. A patient should not be lifted by their arms or their shoulders because this can cause a lot of pain. If the patient has delirium or dementia, this pain could cause an increase in aggressive behavior. Appropriate equipment should be in place and healthcare workers should be properly trained in its use to ensure patient safety and healthcare worker safety. In this scenario, we will look at safe patient handling and mobility and various ways to decrease the risk for pressure ulcers. Let me introduce you to Anita. She has just started her shift. She was told that a new patient has been admitted who is bariatric and requires turning every 1 to 2 hours, and that his skin needs to be assessed regularly, especially between the skin folds. Anita is frustrated because she was sore at the end of her last shift 4 days ago and is not sure that she is fully recovered. She has been working on this unit for 25 years and is only 5 years away from retirement. She's worried that if she injures herself now, she may not make it to retirement. Anita needs to assess Jeff. She asks Ashley for assistance. When Anita walks into the room, she sees that Jeff is on a bariatric bed to accommodate his size, and a low air loss mattress is in place. She also notices that there is a repositioning sling under Jeff, and a panic strap is close by. Anita is unsure how to use this new equipment, but Ashley is the safe patient handling and mobility champion for the unit and is willing to help Anita. The first thing on the list, change Jeff's dressing. Even though his leg is only 2 pounds over the safe lifting limit, it is not a weight that can be held easily for any length of time without putting Anita or Ashley at risk of injury. Lifting of the leg is done by using a mechanical lift with a limb strap. This helps to reduce risk of injury and provide dignity for Jeff. The next thing to do is to check Jeff's skin, including under his pannus. The care plan notes that Jeff's pannus is approximately 40 pounds. One of the ideal conditions for the safe lifting limit of 35 pounds is having the patient close. Obviously, it would be less if Anita reaches across the bed to lift the pannus. This would place Anita in an awkward position and places her at increased risk of injury. As noted before, there was a pannus strap in the room. Ashley talks to Jeff and respectfully attaches the strap to either side of him. Anita and Ashley lift the pannus and check Jeff's skin. No reddened areas are noted. Now, Jeff needs to be turned onto his left side. There's an increased risk of injury to staff when trying to roll a patient with 2 people and a soaker pad or draw sheet. But, thanks to the Safe Patient Handling and Mobility program, there's a ceiling lift in place and a repositioning sling that can do the work. Anita and Ashley just need to put pillows under Jeff's back once he is in the proper position. Now it is time to get Jeff up into a standing position. Do you remember that 35-pound lifting limit? Well, Jeff is at an increased risk of falling because of his weight and an inability to see his feet under his pannus. The physiotherapist has assessed Jeff and determined that it would be dangerous for both Jeff and her to try and stand without the use of a mechanical lift. A floor lift with walking handles and a walking sling are used. If properly set up, a ceiling lift could be used with the sling instead of a floor lift. After a couple of hours, Jeff's skin has been rechecked and Anita has decided that the best position is to have Jeff sitting in a chair. The ceiling lift can make it easier to transfer Jeff to a chair, but Anita notices that the proper size sling is not available. Other options could be manually lifting Jeff and transferring him to the chair. However, the pain from Jeff's knee and the fear of being dropped mean that Anita and Ashley would need to lift a lot more than 35 pounds. The cardiac chair position of the bed could be used, but there could be some shearing of Jeff's skin while moving the bed into that position. There is no great option. When you look at the risks and benefits of each method, including the risk factors of skin shearing, patient safety, and staff safety, using the cardiac chair position seems to be the best option. Hopefully a proper size sling will be available next time for Jeff's safety and dignity and the safety of Anita and Ashley.